So, good morning again, and we are back to our virtual learning study, which today our topic is all about adulthood, care of geriatrics, and emergency care. So, let's start with adulthood. So, in adulthood, we have three phases of adulthood. We have the early or young adulthood, we have the middle adulthood, and we have the late or old adulthood. Of all our patients in the hospitals, okay, most of the percentage of our patients in the hospitals are adults. So we should know what are the things we need to consider, what are the care or quality care that we can give to these types of patients. So early adulthood, usually it begins when adolescence reaches maximum height. For girls, it age for 20 years old, and for boys, usually 22 years old. And it will last until 40 years of age. So middle adulthood, on the other hand, uh, the age will start from 40, then it will end to 60 years old. And the late or old adulthood, it will start from 60 years of age until death. So early adulthood, as we talk about that, it will start from 20s to 40s. So it is a term for transition from adolescence to adulthood that is characterized by experimentation and exploration. So early adulthood is the time of establishing personal and economic independence. This time, if you'll notice, if you have patient who lost their job, okay, they will feel depressed because at this time they are establishing themselves. So the work, their career, their family, it's very important for them. Also, identify exploration, especially in love and work. They have this term intimacy versus isolation. According to Erickson's theory of psychosocial theory, this stage belongs to intimacy versus isolation, which means that they should achieve this intimacy and isolation. Intimacy means not only with their loved ones, but also with their career, with their friends, and with all aspects of their lives. They will feel isolated if they will be, they will not get this intimacy. So this is how early or young adulthood lives. They are, they want instability. They are self-focused. So there is feeling in between. Physical development, most of them achieve the peak of their physical strength, especially in the early 20s or 30s. Although physical changes are minimal during this phase, the weight and the muscle mass change as a result of diet, exercise, pregnancy, and lactation. We all know at this time, 20 to 40 years of age, we will be marrying someone, then we will have family, then we'll have kids. So your body is preparing the body is preparing for pregnancy. So the tendency is maybe you'll gain weight or you lose weight. Growth and strength in early adulthood, then slow process of decline afterwards. Decline affected by health and lifestyles. So these are some physiological changes that will happen to a young adult. So in cardiovascular, men are more likely to have increased cholesterol levels than women. Then gastrointestinal changes at the age of 30, there will be a decreased digestive juices. Then that's why they will be feeling that they are always full. They are not digesting much because of decreased digestive juices. Dental changes by mid 20s, dental maturity is achieved. That's why you will see an emergence of molars or wisdom teeth. Musculoskeletal changes at approximately age 25, skeletal growth is complete. Then reproductive or sexual changes, this system is already matured. So this will be a best time to have pregnancy, okay, or to give birth. Ages to 20 to 30 are optimal years for reproduction. Men beginning at age of 24, male hormones slowly decrease. Does not affect ability to reproduce. Even if you are uh, late adult already, you can still produce offspring as long but the problem is you will have a longer or late erection. Next is their cognitive development, how they learn things. According to Piaget, after the adolescence, uh, all the stages after the adolescence will be uh, on the stage of formal operation stage. So it will be a problem solving abilities realistic, which are realistic. It demonstrates less egocentrisms. Then many young adults are engaged in formal educational activities. So what you will do for this kind of formal operational stage, you can encourage the development and use of appropriate judgment. So this is what I told you about intimacy versus isolation. Okay, the young adulthood, according to Erickson's, will feel intimacy if they have this feeling of intimate relationship with others and if they will not achieve this intimacy, they will feel isolated. For example, if they lost their job, they're not still married, or they still not have family, so what they will feel isolated, and that is normal according to Erickson's theory of psychosocial development. So as a young adult, okay, you will be a parent. So what are the advantages of having a a family in the earlier stage, or what are the advantages of having children in the earlier stage and at the late stage? So first, let us discuss what are the advantages of having children early. First, parents are likely to have more physical energy. Okay, you can match your energy to your children if you will have children at the early stage. Then mother is likely to have a fewer medical problems with pregnancy and childbirth, because if you became pregnant at a late stage, what will happen is you will have a lot of comorbidities or medical problems. So if you will have children at the early stage, you'll prevent these comorbidities. Then parents may be less likely to build up expectations for their children, because they will be understanding to their children because they are their age is closer. While the advantages of having children later, the parents will have had more time to consider life goals. Then the parents will be more mature and will benefit from their life experiences. So at this time, you are already old, okay, so you can share your experiences, your knowledge to your children because you are matured enough. Then parents will be better established in their careers and typically have more income. So you are more stable compared if you have children in an early stage. So you can give everything to your children. You can let your children study in the good school or give them a good education. Friendships. So uh, being a parent is not only the achievement that a young adulthood should have. They should have also the intimacy for their friends. So if you'll notice at this time you have a friends which you can tell your ups and down compared to your friends in the adolescent stage. in this time, you will consider these friends as true friends. So the focus of adult friendship is somewhat different from men and women. For female friends, they tend to confide in one another about their feelings. Okay, if they will feel something, they are irritated, they have problems, and they have personal issues, they will tell it to their female friends. While if you have a male friend, minimize discussions about relationship or personal feelings, because we all know that male are non-vocal. So instead, they tend to do things together that they find mutually interesting, such as activities related to sports or hobbies. Next, what are the health promotion guidelines that we can share to our young adults? First is health test and screening. So, what are those screenings? First is physical examination, dental assessment, vision and hearing, breast self-examination. Okay, breast self-examination, this is done 7 days before or 7 days after your first menstruation on this month. So testicular self-examination also is done for the male patient. And pap smear is done for female patient. Screening for cardiovascular diseases also is done. And others are nutritional and exercise. Nutrition and exercise should be also promoted. Then social interaction. Then stress management techniques are essential, especially if they have uh, problems in their careers. Most of them have depression. So you'll notice patients will be diagnosed with depression because of only personal problems like in their careers or in their family. So this is the thing that we can help to our patient. Next stage is the middle adulthood. Middle adulthood, the period from 40 years of age until 60 years old. Middle adulthood is the time of expanding personal and social involvement and responsibility. It means that you are already settled. Okay, you are already settled at this time because maybe you are already the boss of your company, the owner of a company, or you are already having a stable job, assisting next generation in becoming competent, mature individuals. At this time, you are molding someone to become you. You are molding your employees to become you, or you are training uh your maybe your son or your daughter, your children to become you. So this is the stage of middle adulthood. Reaching and maintaining satisfaction in a career, a decline of physical skills, because at this time physical problems arises like high blood pressure, diabetes, okay, visual impairments. So this will arise in this stage. Balancing work and relationships. Okay, you have already family, then you have already a business. So you are all balancing this different aspects of your lives. A reassessment of life's priorities. So what is your goal? What are your priorities? Maybe you want to expand your business. Maybe you want to train someone to be like you. Maybe you want to add another uh, restaurant or businesses. So this is the middle adulthood. And of course, you are leaving a legacy to someone. Okay, you're making good things to someone. You are joining a foundation, you are sharing to the poor, and all of this we are doing in this stage of middle adulthood. So most of the time, the height, weight, and the strength, the benchmark of change in middle adulthood. The height reaches a maximum during the 20s for most people and remains stable till age of 55. After age 55, okay, you will feel all the physical changes, okay, like your bones become less dense. That's why someone will be diagnosed with osteoporosis, someone will have fracture, and so on. People get shorter with aging due to the bone loss in their vertebrae. Weight typically drops after we reach age 50s, okay, because we will lose fats, likely because we'll lose muscle also and fats. Joint stiffness and difficulty of movement usually accompany a progressive loss of bone in the middle age, and also the development of joint or musculoskeletal conditions like arthritis, osteoporosis, etc. So females may experience bone loss as early as 35 years of age. Men may not experience it until age 65. Muscle strength and stamina may begin to decline. Hair may begin to turn gray and thin. So you'll notice your hair is not black anymore, or the original color of your ethnic community that you belong. So it will turn gray and thin. Then you'll notice that your skin will have wrinkles. So also chronic health problems such as hypertension, heart disease, and diabetes may occur. So these are the changes uh, which happens in this stage of middle adulthood. So in the cardiovascular changes, you have the decreased functional aerobic capacity and decreased cardiac output. Your blood vessels also become thicker and lose elasticity. That's why you'll have the possibility of stroke, hypertension, or any cardiovascular problems. So you can teach your patient to do lifestyle modification. So to quit smoking, avoid taking tobacco, nutrition. So the diet should be low salt and or low fat or low cholesterol diet. Also, sedentary lifestyle is not recommended. They should engage in a physical activity. Brisk walking is the best exercise that they can have. Next changes is neurological changes. Cellular changes, regurgitation, repair, and atrophy. A gradual loss in efficiency of nerve conduction. That's why most of them is always forgetting things. This is related to their age. So you should provide a support and reassurance, teach safety precautions regarding exposure to sunlight, sensitivity to heat stroke, and sensitivity to frostbite, because their sensation will be impaired because there will be a gradual loss of nerve conduction at this time. Also, in the gastrointestinal, they will be having a slower gastrointestinal motility. That's why most of them have constipation. So you teach them how to take a nutritious food like high fiber diet. Okay, so they will have a good uh, bowel movement. Maintain physical activity. Don't always sit. Maintain, mobilize, exercise. In genitourinary changes, nephron units diminish in the number of size, diminish blood supply. So you will notice that most of them, they will be diagnosed with CKD or chronic kidney disease. And most of them, it will be the terminal stage or the stage 4. So they will be having dialysis or any other treatments related to CKD. So teach them uh, signs of dehydration. Okay, so also inform client of need to maintain adequate fluid intake. Okay, instruct client about effects of sun and cigarette smoking on the skin, because they will be having also changes in their skin. There will be skin loss or subcutaneous fat, loss of the skin and subcutaneous fat that leads to the wrinkling of their skin. Musculoskeletal changes, there will be a decrease in bone mass and density, thinning of intervertebral disc, generalized decrease in the muscle tone. So it is very important for them to take calcium supplements because there will be a bone mass and density decrease. So you always tell them to take calcium supplement, very important. Then importance of decreasing caffeine also because it will promote bone mass and density decrease. So tell them not to take too much caffeine uh, or coffee and alcohol. Also, osteoporosis is the number one uh, problem in musculoskeletal system that can happen to them. So, active lifestyle is encouraged. There is increase of risk of injury also for this stage. Instruct client of need for proper posture, especially during sitting, exercise, and adequate fluid intake. In endocrine changes, decreased metabolism results in the reduced production of enzymes and increased hydrochloric acid, lead to acid indigestion and belching. So you tell them to avoid spicy foods, avoid eating within 2 hours before bedtime. Okay, in this way, they will prevent acid in their stomach, increased acid on their stomach. Next, in their reproductive system, there are also changes like cessation of estrogen and progesterone. This is the time where they will be menopausing. So if you're menopausing, this is only happening to girls, okay, you will feel all these problems. You will have pain on your back, you will always have a headache, and it is also the start of your chronic problems like hypertension, diabetes, and so on. So you should teach the client about uh, things like encourage responsible sexual behavior, teach about prevention of sexually transmitted diseases. Okay. For men, there are also changes. There will be a decreased level of testosterone, reduced amount of viable sperm. There will be a decline in sexual energy. It takes longer to achieve an erection, as I've told you before. And adaptation to developing chronic diseases and sexual problems may diminish self-esteem. So you should be a responsible middle-aged adult at this time. So according to Erickson, the psychosocial development for the adult or the middle adulthood is the generativity and stagnation. So what do you mean by generativity and stagnation? It means that you're leaving a legacy to someone or you're leaving a legacy to the world. So what are the things you're doing to leave a legacy? So joining the you're joining a volunteer group or community activities, you are giving to the poor, and you're doing things, altruistic actions to the community. So this is how you will achieve the generativity. While the other one, the stagnation, you'll feel stagnant. Okay, you'll feel that you are not moving. You'll feel that I'm not achieving anything. So you'll feel depressed. So this is the stage of psychosocial development created by Erickson. So if you feel if you see a patient or a middle-aged adulthood, okay, you'll notice that these are the stages that they are having. So most of the middle-aged adult have sensory problems. Like in vision, we have presbyopia. Presbyopia, it is a long-sightedness caused by loss of elasticity of the lens of the eye, occurring typically in the middle and the old age. There will be a decline in the vision, becomes more pronounced. Adaptation to dark and driving at night becomes very difficult to them. Color vision may decline as a result of yellowing of the lens. So instead of blue color, they will distinguish the color as green. So the color vision may decline. Eye lenses becomes hard and cannot accommodate for near vision, results in farsightedness in many people by age of 45. So that is presbyopia. When we're talking about presbycusis, this is the loss for sound of high pitch. So this is presbycusis, another sensory problem of middle-aged adult. So in the female, okay, we have menopause, okay, the cessation of the menstruation. And in the male side, we have the so-called andropause. Andropause, it is a period of physical and psychological change relating to the male reproductive system that occurs during the late middle adulthood. So what are the common signs that you are having andropause? So first, you have the enlargement of your prostate gland. Mind you guys, the enlargement of your prostate gland can lead to cancer. So always check your prostate gland by doing digital rectal examination or going for consultation. So to prevent the uh, cancerous type of enlargement of the prostate. So you'll notice that if your prostate is enlarged, what will happen is you will have difficulty urinating, and you want to urinate but you cannot urinate. Also, men still produce sperm and can father children through middle age. Even the male is already 99 years old, he can reproduce an offspring as long as he has sperm. But for female, he cannot reproduce if he's already of or if she's already menopause. So that's how male and female differs. So in menopause, you'll notice that the female have hot flashes, headaches, feeling dizzy. There will be heart palpitations and aching joints. So these are common during menopause. So same with their cognitive development, they will be in formal operations stage. So some intellectual abilities decline in middle age, but others increase. Like we have two intelligence, like crystallized intelligence and fluid intelligence. When we're talking about crystallized intelligence, it is acquired store of information, skills, strategies, increases. So it will increase during adulthood. Acquired store of information, skills, and strategies. So you'll notice your grandfather will tell you a lot of things, a lot of information that you don't know. So this is called crystallized intelligence. While fluid intelligence, it is the ability to deal with a new situation. You can easily adapt to a new situations. It begins to decline in the middle adulthood. So crystallized intelligence will increase in the middle adulthood, while the fluid intelligence, it will decline during the middle adulthood. So I told you about generativity versus stagnation. So aspects of care for the middle adult. First is adequate rest is needed to be able to perform daily tasks. The need for social contact continues. Stress management techniques should be applied. And regular health and dental checkups should continue. Because I've told you that at this time, all the chronic problems or health problems will arise. So yearly, you should check your health so to prevent the complication of these health problems. So this is middle adulthood. So let's go with the care of geriatrics. So if we are going to Canada, USA, and other countries, okay, that we are dreaming of, most of our patients there are geriatrics. Okay, we will earn dollars for this uh, uh, type of patient. So we should know how to deal with them. We should know how to take care of them because geriatrics is not that easy to deal with because they have a lot of problems, issues like Alzheimer's, Parkinson's disease, and so on. So first, let us start with the definition of terms. So what is gerontology? Gerontology is the study of the aging process. Then geriatrics, it is the care of aging people. So it starts from 60 years old until death. So first, what are the physical changes which happens to the geriatrics in their integumentary system? So first, they have the skin becomes less elastic, the skin loses strength, there will be brown spot. So you'll notice that there are spots, brown spots in their skin. Fewer nerve endings, fewer blood vessels. If you have fewer nerve endings, so your sensation will decrease. So you will not know that you already have this burns or you already have these frostbites. Fewer blood vessels, fatty tissue layer is lost. So you'll notice that there will be a wrinkling of the skin. Then skin thins and sags. Skin is fragile and easily injured, and folds, lines, and wrinkles appear. So also, the blood vessels in the dermis become more fragile. So if you notice that the nurses, okay, has difficulty inserting IV cannula for this type of patient because their blood vessel is already fragile. Then decreased secretion of oil and sweat glands, dry skin, itching, increased sensitivity to heat and cold. There will be a decreased sensitivity to pain. Nails become thick and tough, whitening or graying hair, facial hair in some women. Because this is because of the hormonal change. So, common problems that can arise in their integumentary system are pressure sores, okay? Because the skin is already fragile, pressure sores might arise. Also, there will be herpes zoster, dermatitis, pruritus, okay, or itching, and bone structure is prominent. So how to take care of their integumentary system? First, protect the person from drafts and cold. Most of them, because of their loss of subcutaneous tissue, they will feel always cold. So don't force them to take a bath every day or twice a day because they cannot, because they are always feeling cold. So always offer them a sweater, lap blankets, socks, extra blankets are also helpful. Shower or bath twice a week is enough for hygiene, even if You think that it is not hygienic, but you should understand their situation. Their subcutaneous tissue is already lost, so they will feel cold. Avoid solar exposure because their skin is thin already. Clothe dress appropriately for temperature. So always depend the clothing on the weather and the environment. Maintain a safe indoor temperature. Excessive use of soap should be avoided. You can use mild soap. Okay, if you have, this will help the skin of the patient not to irritate the skin of the patient. Apply cream for lubrication of the skin because most of them have dry skin. Next, these are the changes on their musculoskeletal system. They have muscle atrophy. Okay, they have strength, tone, and contractibility decreases. There will be a decrease in bone mass also. Their bones will be weaker. It will also be brittle. Their vertebrae will be shortened. That's why they will not stand straight anymore because of the vertebrae will be shortened. Then joints become stiff and painful. This is because of the arthritis. Hip and knee joint become flex. There will be gradual loss of height. The trunk becomes shorter and there will be a decreased mobility. So common problems for them are Paget's disease. This is the diseases of the bones. Osteoporosis. Okay, osteoporosis, you have the osteomalacia, you have the rheumatoid arthritis, the spondylosis, the complaints of back pain and joint pain. There will be stiffness of joints. You have the fractures, foot pathology, gait disturbances. Most of them, they are having fractures on their pelvis. So please take care of this geriatrics because if they will have the fracture in their pelvis, it's very difficult to treat. Especially they are old, we cannot perform surgery anymore because it will be life-threatening for them. So extra care is given to this type of patient. So the nursing care for their musculoskeletal system changes are exercise regularly. Brisk walking is enough for them. Okay, mobilization like standing, sitting, or going to the hallway or walking to the hallway is enough. Then eat high calcium diet because their bone mass and density decrease already. So you should encourage them to eat high calcium diet and to take calcium supplement. Limit phosphorus intake because it will decrease your calcium. Hormones and calcium supplements may be prescribed. In their nervous system, their brain and spinal cord lose nerve cells. That's why they will be a decrease in their sensory or sensation. So reflexes are slow, okay? Also reduce blood flow to the brain. There will be an abnormal structure formed in the brain. Brain tissue may atrophy. That's why they will be having Alzheimer's disease or dementia because their brains are having an atrophy. Or what do you mean by atrophy? It decreases in size. Changes in brain cells happen also. So there will be a shorter memory, forgetfulness, slower ability to respond, confusion, dizziness, sleep pattern changes. There will be also reduced sensitivity to touch, sensitivity to pain, smell and taste decrease. Okay, then eyelids thin and wrinkle, less tear secretion, pupils less responsive to light. There will be also pupils less responsive to light. There will be a decreased vision at night or in the dark. That's why they are prone to fall if you don't have a night light. So always make sure that you have a night light in the hospital or in the room. Problem seeing green and blue colors. Okay, their color vision will be decreased. Changes in acoustic nerve. Acoustic nerve is the nerve which is responsible for your hearing. That's why most of them they have hearing impairment. Eardrums atrophy. Okay, it will decrease in size. High pitched sounds are not heard. This is presbycusis. And decreased earwax secretion. And there will be hearing loss. So common health problems for this type of patient is Parkinsonism. So you'll notice, or Parkinson's disease, you'll notice that they have these tremors, rigidity, and slowness of movement. They will also have Alzheimer's disease. This is loss of short-term memory, and there will be a deterioration in the behavior and slowness of thought. So this is not easy to manage, especially if your patient is agitated, your patient is wandering. So you should give an extra care to your patient. Dementia, it is a chronic or persistent disorder of behavior and higher intellectual function due to organic brain disease. So most probably if you have dementia, you'll have Alzheimer's disease. But dementia, it is can be treated, but Alzheimer's disease, it cannot be treated. Or I mean, dementia, it is reversible, but Alzheimer's disease is irreversible. There will also be depression as common health problems and anxiety. There will be also sleep disturbances. So what are nursing care for this type of patient? We need to advise for hospitalization and encourage visitors because most of them will feel depressed. If you will see movies of aging population or geriatric patients, okay, you'll notice that most of them are depressed. So we should encourage visitors. So if there's more visitor, there will be more socialization and this depression will be treated. Then teach fall prevention technique because they have this sensory problems or impairments. They are easy to fall or high risk to fall. So we should teach them how to prevent fall. Environmental safety like sufficient light, proper chairs for sitting, and elevated toilet seats is encouraged. We should encourage also slow rising from resting position, which means that if you are lying on bed and then you're going to sit, you should sit slowly to prevent orthostatic hypotension. And if you are from sitting, then you want to stand, you should move slowly so you'll prevent also orthostatic hypotension. It will also reduce the risk of fall. In our circulatory system, our heart pumps with less force. Before, when we are young, our heart pumps forcefully. But during geriatric stage, our heart pumps less. So there will be tendency that we'll be having heart problems, cardiac diseases, or heart failure. Your heart rate may slow also. Abnormal heart rhythms may occur. Then it will be also your heart will be enlarged, like cardiomegaly, and it will thicken the heart walls or the blood vessels there. And arteries will be narrow and become stiffer. So you will notice that there will be high blood pressure, cardiac diseases, or clot in the heart. So the common health problems for their circulatory system are hypertension, ischemic heart disease. Okay, ischemic heart disease is myocardial infarction, heart failure, peripheral vascular disease, varicose veins. You have also the stroke or stroke attack. So what are we going to do First, we need to exercise regularly, pace activities, avoid smoking, encourage nutritious food like low-fat, low-salt diet, weight control, and we should monitor our vital signs, especially our blood pressure, regularly. We should participate in stress reduction activities. As long as we are stressed, we are also stressing our circulatory system. That's why some people, if they are stressed, they will have cardiac disease or heart attack just only because of stress. And of course, they should take their regular medication. If they are diagnosed of having heart problems, high blood pressure, they should take this the medication prescribed to them for lifetime. If they will stop it, okay, what will happen? It will be more complicated to treat. For respiratory system, most of the changes are lung tissue is lost. The lung tissue is becomes less elastic. So the tendency is it will be not expanding. Then difficulty breathing or dyspnea. Then decrease stretching for coughing and clearing the airway. So common health problems for them are chronic pneumonia. We have also COPD or obstructive pulmonary disease. We have dyspnea and breathlessness. So our nursing care is, of course, we should encourage deep breathing exercises, avoid smoking, take adequate fluids. Adequate fluids will help the secretions to be liquefied. So they will flush it from their body. Prevent pulmonary infections. How you will prevent pulmonary infections, you need to mobilize. Because most of the infectious agent, okay, they will be attracted on those areas that have no movement, like the pneumonia microorganisms. So you should encourage the patient to move. Then avoid crowds during cold and flu season. Wash hands frequently to prevent infection. Wait a minute, I think my okay. I think my headset is already low bat. Okay, still there. So let's continue. Geriatrics. Next, on their digestive system, the changes are decreased saliva production. They have also decreased swallowing or dysphagia, decreased appetite, decreased secretion, difficulty digesting fried and fatty foods, indigestion, loss of teeth, decreased peristalsis. That's why they are having constipation. So common problems for them are problems with speech, chewing, and swallowing. They are already, most of them have constipation, colon gas, and fecal impaction because their peristalsis is decreased. Diarrhea, they have GERD or gastroesophageal reflux or hernia. Fecal incontinence, prolapse rectum. They have also dysphagia and anorexia. So what are the nursing care? Use ice chips. Okay, ice chips, mouthwash, brush, massage gums daily. They should eat small, frequent meals. They should eat high fiber diet, low fat diet, limit laxatives. Laxatives are those medications that can make you defecate. Why do you will limit laxatives? It's because they will be dependent on it. So just advise them nutritious food like high fiber diet and low fat diet. So toilet regularly, drink adequate fluid. For appetite, serve food attractively and different types of food. That's why sometimes we are studying how to serve food. Okay, what are the basic techniques how to make the food appetizing and or appealing. Next is urinary system. Urinary system, there will be a decreased kidney function. There will be also reduced in blood supply to the kidneys. The kidneys will atrophy or it will decrease in the size. Bladder tissue less able to stretch. Bladder muscles weakens. Bladder may not empty completely when urinating. Urinary frequency, urinary urgency may occur. Urinary incontinence may occur. Nighttime urination may occur or nocturia. So common health problems are renal insufficiency, urinary incontinence, urinary tract infection, enlarged prostate, and sexual dysfunction. At this time, they don't have libido. Okay, they don't have that kind of libido that you have, that they had when they were younger. So nursing care, regular supervision is necessary. Ready access to toilets. So most of them, they are putting uh, urinal bottle or bedpan or commode chair next to the patient's bed. Then drink adequate fluids. Avoid bladder irritants like alcohol, caffeine. Okay, it will make you pee. It will make you void. It will uh, let you void, especially in the night. Practice pelvic floor exercises like Kegels exercises. Maintain perineal hygiene to prevent skin problems. Skin should be clean and dry. Apply cream so to prevent uh, the dryness of the skin. And clean underclothes. For reproductive system, we should also we should also take note that changes in testosterone, it will decrease the testosterone level. Erections takes longer phase between erection and orgasm. It will be less forceful orgasms. Erections lost quickly, longer time between erections. For women, menopause will arise as early as middle-aged adult. Estrogen and progesterone decrease. Uterus, vagina, genitalia atrophy, thinning of the vaginal walls, vaginal dryness. Okay, so it's very difficult for them to have sex at this time because they have already vaginal dryness. Arousal takes longer, less intense orgasms, quicker return to pre-exciting state. So common health problems for female are breast cancers, cervical cancer, painful intercourse because it's already dry, vaginal bleeding, vaginal itching, and irritation. For male, there will be prostate cancer and delayed erection. So our nursing care is our health and sexual counseling, advice about personal hygiene. So this ends